Pfizer is committing to offer all of their prescription medications to Medicaid, and it will be at the most favored nation's prices. It's going to have a huge impact on bringing Medicaid costs down like nothing else.
That was President Trump at the White House on Tuesday, announcing that Pfizer has agreed to offer most favored nation pricing to Medicaid, matching the lowest price offered in other developed nations. Pfizer also announced it will participate in a new website that will be launched next year by the administration named TrumpRx.gov. On it, Pfizer said it would offer treatments at a discount, but only for patients not using insurance. The Wall Street Journal reported yesterday that if you have health insurance, that new site unlikely to save you any money. Joining us now, NBC News medical contributor Dr. Vin Gupta. Dr. Gupta, always great to see you. Let's start there. Your impressions on this new program. Certainly, no one's going to argue that it'd be nice to get a handle on prescription drug pricing, but do you think this is the way to do it?
Hey, Jonathan, good morning. It's, as you mentioned, good that we're talking about lowering drug prices. This has been a bipartisan goal for decades, but activity for activity's sake, that's what we have to be cautious about. Trump RX, you said this. Is there something new here? And there's Cost Plus from Mark Cuban. Some pharmaceutical companies are doing direct-to-consumer offerings that do something very similar, like Lilly Direct or Pfizer for All. So the question here is there something net new here? Doesn't seem like that's the case. And then also, what's the long-term incentive for patients and health systems and providers to actually utilize this if the president's going to be out of office in 2.5 to 3 years? So that's the question. Why not actually partner with a brand like GoodRx that's already doing this, instead of starting from scratch, and then in 3 years' time or less than 3 years, who's actually going to even utilize this? So that's the concern here, is this activity for activity's sake versus meaningful progress, like the Inflation Reduction Act and what the Biden administration did with Medicare drug price negotiations. That's statute, that's law. This is all voluntary. And we have to see, will the other 16 companies, actually pharmaceutical companies, comply here? Who knows?
Yeah, we'll be watching that in the days, weeks ahead. Dr. Gupta, switching gears, we heard from Secretary Kennedy again this week on vaccines. We wanted to give you a chance to identify things you believe he got wrong.
Well, this is a video, I don't want to direct anybody to watch it, but he posted a few days ago a video on the HHS X account, and he actually took aim at my home state senator, Senator Maria Cantwell. They had an exchange at a hearing recently. He misled throughout the video. And we have a few graphics here. Since he showed a few graphics, we're going to show a few graphics. One is the impact of vaccination, Jonathan, on polio cases in the United States of America. And it's very clear that vaccines, he downplayed the role of vaccines throughout that 7-minute video, said it was better sanitation, other things in civil society that have reduced burden of infectious diseases. He's not wrong. There's some truth to that. Of course, it's multimodal, but he then also completely downplayed the role of vaccines in saving lives. It's very clear here with the polio cases. When it comes to polio, vaccines completely eliminated polio in this country. And despite his best efforts here, hopefully that will remain the case. Rubella, we'll also show that for your viewers. Rubella cases also declined dramatically after the introduction of vaccination. So he's wrong. He didn't want to talk about COVID or flu vaccines that keep people out of the ICU. So he cherry picks data, he tells half-truths, and he was completely wrong there in that interaction with Senator Cantwell.
So, Michael, this is certainly, these are worrisome trends. A lot of this felt like settled medicine, settled science. And here we are, experts like Dr. Gupta warning us nearly daily that we could find ourselves confronting terrible diseases that we thought we had largely eradicated.
It's unbelievable. And, where is this going to go? How many people are going to have to get sick or even die, before something changes here? They have the power. They're in office and they can do what they want to do, and they don't need to wait for legislation. Kennedy could just announce these things. The president could just announce these things, and they can impose them. But the people don't want this. I think it's very clear the people don't want this. The vast majority of people think vaccines, rightly, are useful and necessary, and they're just going to wreak havoc on the public health of this country.
So, Dr. Gupta, we've spent a lot of time last couple of days talking about the impacts of the government shutdown. There's certainly no end in sight there. Talk to us about how it may impact the nation's health.
Yeah, a few different things, Jonathan. You earlier in the show, you were talking about the ACA subsidies, the Affordable Care Act subsidies. The expectation here is that these expire with the shutdown, and so 4 million people across the country, at least, Jonathan, rely 4 million families on these subsidies to afford healthcare insurance. So what happens when these subsidies expire? Their premiums almost double. And so that definitely impacts access to healthcare in an affordable manner. So that's number one. We also know that telehealth and in-home care visits are entirely reliant on funding that actually expired with the government shutdown. So those seniors, for example, that might rely on healthcare in the home or telehealth services, those are not currently funded right now. There's going to be Medicare and Medicaid payment delays to hospitals and hospital staffs. They will not be eliminated, but there will be delays. So that means, Jonathan, potentially putting some staff on furloughs, which will mean delays in care, a lot of frustration in health systems across the country. So there's clear impacts both to how money is being spent, what that means for staff and payroll, and then also access to basic health care at home.
NBC News medical contributor Dr. Vin Gupta. Dr. Gupta, thank you as always. We really appreciate it. And Simone, we've obviously spent plenty of time talking about messaging the Democrats should be putting forth on the shutdown. I mean, to me, it seems like they almost have too many things to choose from. It's hard to focus in on one. They've chosen on, in some ways, health care, but a part of that could be perhaps sort of what Dr. Gupta just said about how this is going to literally make the nation sicker.
Yeah, I love to take my talking points from Dr. Gupta, to be honest. I was sitting here taking notes as he was speaking. Look, I think that Democrats, the challenge is, because so much is happening, you don't want to have 50 different things you're talking about, because then the message gets muddled. So I think healthcare is the overarching thing. Healthcare, that people are going to lose healthcare if the Democrats, do not do something. I think that is the strongest footing to be on. And then all of these secondary things after that. Additionally, you also got to talk about the fact that Democrats are working and they want to come to a deal. They want to come to a resolution. But their Republican counterparts were literally not in Washington, D.C. these last couple of days to talk about it. From the beginning, the president had said, we're not negotiating with Democrats. And so I've been quite critical of Democratic elected leadership, but I do think credit where credit is due. Hakeem Jeffries and Chuck Schumer got a meeting with the president because they forced the issue. They, I believe, right now have the upper hand on the messaging battle, if you will. We'll see how it shakes out over the next couple of days, but Democrats have to be out there, not just on cable and radio all over the country and in their districts, but also on social media. I've enjoyed the videos that I've been seeing, Mika. It seems to me that they've understood the message. How long, though, can they keep this up? I'm hopeful for a long time, because healthcare is very, very, very important.
Simone Sanders Townsend, thank you as always for being on the show this morning, and we'll be watching The Weeknight at 7 p.m. right here on MSNBC.